Many people want lower eyelid surgery to address fat bags under their eyes or depression or hollowing under their cheeks or excess loose skin. We offer a variety of procedures for this. Some of the most common is working on the inside of the eyelid to remove some fat or reposition that fat into the tear trough groove. Sometimes we do fat grafting to the cheek, and sometimes we do a skin pinch to get rid of some of that loose skin. This surgery is almost always performed under general anesthesia, so you do need to go to sleep. Anytime you go under general anesthesia, there's a small risk of something serious like a heart attack or stroke, but for a healthy person, that risk is extremely low. When we go into the eye, particularly through the lower eyelid, there's a very small risk of bleeding inside the eye that could even put pressure on the eye and being vision threatening. That's not something I've seen so far, but is possible. We also go extremely near some of the muscles that move the eye, and so there is a very small risk of injury to those eye muscles, which could lead to permanent double vision, which can be a serious issue needing further intervention. With that being said, those things are extremely rare. When we move fat from the eyelid or recontour it, move it into the lower cheek, what's called a fat transposition, or put fat into the tear trough, sometimes it's not enough fat, or sometimes that fat fades away with time, and so a portion of patients will need a small revision to add more tissue there or to move things around. That should be a very small number of patients. If we do any skin excision to the lower eyelids, there's usually an incision right below the lash line, and we do a small skin pinch. A rare but serious complication is that you can get an ectropion, which is pulling down of the lower lid. That can be somewhat challenging to fix. We usually put in a preventive stitch to tighten the lower lid to prevent that, but it's still possible.